Gypsy Rose Blanchard, just a few days shy of her 33rd birthday, has recently announced she is about to enter her second trimester in pregnancy.
So I know the rumors have been flying around for quite some time now. I'm happy to announce that I am 11 weeks pregnant. Ken and I are expecting our very first child come January of 2025. We're both very excited. This was not planned at all. It was completely unexpected.
As many of you know, Gypsy Rose was convicted of second-degree murder while in her early 20s for conspiring to kill her mother, Dee Dee, after reportedly suffering severe abuse at the hands of her mother. The abuse alleged to have been inflicted on Gypsy Rose by Dee Dee is very reminiscent of a mental illness referred by laymen as Munchausen by proxy. As far as I can tell, Dee Dee was never officially diagnosed. So although the evidence seems insurmountable, I'll keep saying alleged because I never want to throw out an unofficial diagnosis without having assessed the person myself, or what the medical community now knows as factitious disorder imposed on another, or FDIA. FDIA is a type of abuse where a caregiver intentionally causes or fakes symptoms in a person under their care, it's usually a child, to receive medical attention, special favors, and money. The caregiver may claim that the person is sick, injured, or having trouble functioning, and may even induce symptoms of illness by giving the person harmful substances and unneeded treatments, such as a feeding tube, as in the case of Gypsy Rose. FDIA can be very dangerous and potentially even lethal, and can put the victim in serious danger of injury or unnecessary medical care. FDIA results in fatalities for 6 to 10% of victims, making it one of the most lethal forms of medical abuse. In addition to the physical harm and the risk of fatality, the trauma experienced by victims of FDIA is often severe and fairly all-encompassing, particularly in cases of childhood abuse at the level of severity purported to have occurred to Gypsy Rose at the hands of her mother. Needless to say, I sincerely hope that Gypsy Rose is getting consistent counseling from a really good therapist. Regardless of your opinions about her crimes or her actions after serving her time, I'd say she deserves it. I have worked with clients over the years who are adult survivors of childhood abuse and have learned some really important techniques to help them to learn how to live without being imprisoned by a history of pain. I would have a checklist of concerns and, just as important, strengths to encourage my client to build upon. In discussing Gypsy Rose, who was allegedly an adult victim of FDIA who has been in prison and is now expecting a baby not 8 months after she was released from prison, I hope also to help shed some light on the difficulties of living with trauma from childhood abuse, the importance of breaking that cycle. First, there have been a lot of changes in a very short period of time for Gypsy. She was released from prison in December of 2023 after spending 10 years of her adult life incarcerated. There has been a whirlwind of media surrounding her, some of which she courted, some of which she produced herself. She filed for divorce in April and later that month reconciled with a former boyfriend. In her 32 years, she has gone from a toxic bubble of childhood into young adulthood. She assisted her boyfriend at the time to murder her mother to escape all the horrific abuse she endured. A decade of prison, release from prison, marriage to Ryan, filing for divorce from Ryan, getting back together with a different ex-boyfriend, Ken, she had while she was in prison, then starting a family within less than a year. Anybody going through all of those major life changes needs a lot of time to take a deep dive into all the trauma they have undergone with a really healthy support team. As a therapist who worked with people in crisis and trauma for almost 30 years, man, I'm old. I would strongly encourage Gypsy to separate herself from all of the media and take some time to learn healthy coping mechanisms, unlearn very unhealthy ways to have relationships, and learn better ways to relate to and interact with others in a real, genuine way. I know, I already hear people out there saying, but she had counseling in prison, didn't she? I don't know what kind of specific counseling Gypsy Rose herself went through at Chillicothe. I have been a supervisor of a DUI program in a women's prison, and I can tell you there are a couple of things to consider about counseling while incarcerated from my experience. Number one, prison is very different from the outside world. This is intentional because it is so vastly different from life outside. It can be very difficult to prepare clients for life post-incarceration or to let them practice applying the real-world coping mechanisms that their therapist may recommend for them. Number two, inside this isolated bubble of prison life, the therapy programs provide informative classes frequently led by dedicated, capable, and caring therapists. However, the focus in that situation is on coping with life in prison and on counteracting behaviors that can lead to reoffending, less than on treating the underlying emotional causes of all these behaviors. Three, I don't know if you know this, it's probably going to come as a real shock to most of you, but there's no privacy in prison. I know, it's a shock. Gypsy Rose needs some time to just be. I watched the Lifetime docuseries, and as I saw her at her grandmother's gravesite, I thought, we shouldn't be saying this. Cameras shouldn't be there in your face as you are communing with your grandmother. I can't help but think that real grief work can't happen if it was turned into what we were seeing, a production. I really hope Gypsy Rose gives herself the gift some alone time to get to know herself. I used to work with victims in sheriff's departments, victim services, and I would remind victims all the time at the crime scenes where media had flocked to, they had no obligation to answer any questions posed by the media. I sincerely hope she allows herself time to be herself. And I recommend starting now because you get very little time to yourself to reflect, to be mindful, to be private when you are a parent to a newborn. Sometimes you don't even have a chance to really shower. You get very little time to yourself as a parent, period. There is a good chance that going to counseling is part of Gypsy Rose's parole requirements. Not only do I genuinely hope Gypsy Rose is truly dedicating herself to her mental health treatment, I hope she's in a good mental health treatment for a very long time. You see, triggers of childhood trauma are intensified when your child reaches the age you were at the time of your trauma. Gypsy Rose was incorrectly diagnosed with leukemia at the age of 8. Around the time her child turns 8, she could find herself with all of her feelings highly intensified. Anxiety, depression, every vulnerability is going to be on full blast as she raises her child. She might start excessively worrying about common symptoms of childhood illnesses. She's going to need a lot of good insight into what is going on and how to handle it in the best way possible. Another factor for Gypsy Rose and her treatment team to consider is that she has been emotionally and developmentally delayed not only by the isolated and abusive treatment she received at the hands of her mother, but she has dealt with drug addiction. Not only was she given pain medication as her brain was developing, but she not surprisingly used drugs in prison life, as she herself stated, reminding her of how she felt while she was on those pain medications. You are frozen at the age that you start a drug addiction. It's only when you let yourself deal with life on life's terms, completely sober, and allowing yourself to actually feel negative emotions and learn how to emotionally regulate and communicate with loved ones and function and move forward, even when bad things happen. And then you will begin to mature. I'm also so very concerned about the very real possibility of Gypsy Rose raising her child up in the public eye.
I really feel strongly that I don't want my baby to be in front of a camera.
Gypsy Rose Blanchard is in protective mom mode. During a July 12th interview on Good Morning America, Gypsy shares that while she's still in the early stages of her pregnancy, she has already made a major decision for her future child.
I will not be putting my child in the media at all.
The 32-year-old announced earlier this month that she was expecting her first child with boyfriend Ken Urker. And while Gypsy is currently starring in her own Lifetime docuseries Gypsy Rose, Life After Lockup, it's not something she wants for her baby.
And will there be another docuseries down the road? Will the cameras continue to roll?
I don't know yet. You never know what the future holds with that. But once the baby's born, I really feel strongly that I don't want my baby to be in front of a camera. Unless it's for like home movies.
Going on to reveal the reason why she believes it's safer to keep her child's life private.
This world is so cruel and unsafe that there is a level of responsibility that I have to make sure that my child is protected.
Gypsy garnered national attention when she pled guilty to second-degree murder for plotting to have her mother, Claudine Dee Dee Blanchard, killed. After serving more than 8 years in prison, she was released in December 2023, with Gypsy going on to announce her pregnancy in an emotional video posted to her YouTube channel on July 9th.
Knowing that I am a mother now. And I'm happy. And I just want to be a good mother for my child. I want to be everything my mother wasn't.
I hope she means that to her core and will stick by that. The damage that could cause a vulnerable child is huge, especially the child of a woman who has had so much controversy caused to her and caused by her. Being brought up to constantly be the image of what other people want you to be can very easily lead to someone who has no internal sense of self, no real moral compass, other than being guided by others, no permission to feel negative emotions, and to be less than perfect in the eyes of others. Not to mention the physical safety of a child who is so much on social media. This kind of exposure, even if this family withdraws from the cameras altogether right now, can lead to, honestly, I don't want to think about what it could lead to. Once a child is marketed to the public through the media, either social or otherwise, their safety will always be in question. It's going to be difficult to navigate trying to keep this child's life as, for lack of a better term, normal as possible, free from the very real shadow of their mother's history. As Gypsy said to Lifetime, she wants to live a simple life. I hope she wants that for her child too. With the right kind of openness and honesty and support, I believe it can be done, as long as Gypsy Rose truly acknowledges her child's need for guidance and have healthy people in their lives who are real, knowledgeable, kind, and firm. There's only a very minuscule chance you will ever see this video, Gypsy. But if you do, please break the cycle. You said very wisely that you don't want to be the kind of mother you had to suffer with. You have said that you are in therapy, and I truly applaud you for that. Considering how traumatic the medical community has been for you, it is so very brave of you to be in therapy. Please stay in counseling. Be proactive. Don't just let things happen to you, including the media. Surround yourself with down-to-earth, real people whose parenting style lies somewhere in the middle between protective to the point of suffocating their children and leaving kids just to raise themselves. Find examples that live in the middle ground and hang out with them and learn from those healthy families. Spend time with regular folks who are anywhere near the public eye and don't default to manipulation and criminal thinking like your mother did. Develop your love of arts and crafts and spend some time just with you doing just that and other hobbies you love and will discover. Remember, your scars are your badges of courage and survival. Practice mindfulness. Keep journaling. Keep deep diving into your own psyche, not to wreck yourself with guilt, but to learn from your past and your mother's past. Never be afraid to admit so-called negative feelings to yourself and to others who are safe. It is okay to have frown time. In fact, it's necessary. Just don't take that out on others. Learn healthy ways of coping and loving and living and boundary setting and stress relief and managing negative feelings and impulsive thoughts. You have strengths that you can build upon and grow within yourself and within your friends and family. You have shown strengths of resilience and charisma and articulation. You have shown some insight into your own issues and situations that you can build upon. Grow these strengths for yourself, for your child, for your family, and your community. Please strongly consider giving yourself the same grace you are planning on giving your child in staying out of the public eye for a good long while. You need time to ground and grow your sense of self. Just because there are, millions of people clamoring for news of you does not mean you owe them one iota. You don't owe any of us a single thing. You need to learn how to communicate in relationships on a real heart-to-heart level, on a very non-transactional level. And that's going to take some time. Learn that parasocial relationships are not real, even though they can be fun and exhilarating, and you can experience so many emotions in them. Find out what it's like to live on the outside without cameras stuck in your face. You deserve that. You deserve that, and so do the people who truly love you and wish the best for you. Most of all, your child deserves that. Okay, down off my soapbox now. If you've endured childhood trauma and abuse, I really encourage you to seek help today. Here in Texas, we have 211 for help. They can connect you to resources, most of them being absolutely free. I'm including a link to some free resources in the description below. If you are employed, consider reaching out to your employee assistant program. Call your health insurance for some help with finding a provider who is right for you. Check out Psychology Today. They verify all of their therapists, and you can look up by location for free on the good old World Wide Webs. And if you suspect a child who is suffering abuse, please call your state's version of Child Protective Services. CPS is far from perfect, and those in the front lines will tell you just that themselves. I know a lot of people who work for CPS, and most truly want to help save children and families, so please call, and at least you will know that you did your due diligence. One last message. I understand from Gypsy Rose, and it makes a lot of unfortunate sense to me, that people have been leaving her death threats. To anybody who has done that, who has texted or has left comments or emailed, done anything to threaten to murder Gypsy Rose, I have a very heartfelt message for you. Stop. You're not helping anyone. If you're unhappy, it's not because of a stranger on the media screen. You are unhappy because of something going on internally. Stop trying to run from that and deal with it directly. Violence is not the answer. Get some help. So Gypsy Rose, and any of you who need to hear this right now, be your own safe place.
And don't throw a hissy fit.